Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today I'm going to be continuing going through the Blue Book. This is the first trimester of pregnancy. It's actually in the Blue Book, it's under dangers and discomforts of pregnancy. And it's even more than that because we're going to be using the prioritization strategies that we learned in my last video when it says, which of the following findings are you most concerned about? So let's go ahead and get started with that. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Today, come here, Kodak. Come here, buddy. Today, my big dog is here visiting me. This is Kodak. He's my Newfoundland. Any of you have a Newfoundland? These are gentle giants. He's a big sweetie. My other two dogs, Barkley and Israel, are actually his sons. He and another of our dogs that lives in another with my daughter had puppies. So we kept two of them, and they are the sweetest babies. He is a really good dog. So we're continuing to walk through the Blue Book. We're going to be doing the first trimester dangers and discomforts of pregnancy. You know that this channel is part of the greater Clinic Review organization where you can take our NCLEX review. Our NCLEX review is an online on-demand review that you can get up to 3 months. Maybe you can get longer than 3 months. I'm not sure. But Mark Klimek teaches that. And then we also have our monthly packages for small group tutoring. And we also have our streaming service. All right. Well, let's go ahead and get started. This is actually some really important information. It's very fundamental, and you definitely should know it. So let's go ahead and get started with it. A client in her first trimester of pregnancy visits the prenatal clinic. She reports several symptoms to the nurse. Which assessment finding is most concerning? So remember, in my previous video to this, I taught you that when they give you the patient's diagnosis and all the findings are in the answers, you always choose the unexpected finding to be most concerned about. So she doesn't have a diagnosis per se because she's not sick, but we do have something that describes her. She's in her first trimester of pregnancy. So that's the key thing. So we're looking for the unexpected finding during the first trimester of pregnancy. That's always what we're most concerned about. The client experiences morning nausea and occasional vomiting. That's expected. That's normal. Discomfort of pregnancy. The client reports urinary frequency during the day and night. Y'all, that is a discomfort of pregnancy. It occurs in the first and third trimesters. Urinary frequency. The client has mild swelling in her ankles by the evening. Well, if she had sudden swelling in her ankles, I'd be concerned about, but mild swelling in her ankles by the evening is pretty common. She's having an increase in vascular volume. And so she does have more swelling. The client reports sharp abdominal pain and vaginal spotting. Unexpected, y'all. Any sharp pain is very unexpected. We don't want to see that. So that's what we are most concerned about. A client at 12 weeks gestation, which is the end of the first trimester, expresses concern about not gaining any weight due to persistent nausea and vomiting. What is the nurse's best response? All right. So during the first trimester, they're supposed to gain 3 pounds. They're supposed to gain 1 pound a month. And that can range anywhere between, they could gain up to 6 pounds, probably, but between 3 and 6 pounds, maybe 2 pounds, like 2 to 6 pounds would be acceptable, but they should gain some weight in the first trimester. Not a lot, but a little bit. So what is the nurse's? So she's saying she hasn't gained any weight. So I say that's unexpected. And what do we do with unexpected findings? We have to report it to the healthcare provider. We have to intervene immediately. We're most concerned about that. So I'm looking for an answer that says, yeah, I'm concerned about that. It's common not to gain weight in the first trimester. That's false. Let's discuss ways to manage your nausea. Well, we definitely should discuss ways to manage the nausea, but the first half of that is a false statement. You should try to eat more to ensure you start gaining weight. Maybe, but she's not gaining weight because she's nauseated and vomiting. So I don't know if that's going to help. Not gaining weight is concerning. There you go. I'll notify your healthcare provider immediately. Exactly right. So it says, I'm concerned about that. I'm going to have to notify the healthcare provider. That's the right answer. Don't worry about weight gain now. It's only important in the second and third trimesters. Well, they certainly gain more weight in the second and third trimesters. They gain 1 pound a week in the second and third trimesters, but they still should gain weight in the first trimester. So my best response is to show them that I am concerned. This is an unexpected finding. A pregnant client at 9 weeks gestation comes for a routine checkup. Okay, 9 weeks the first trimester. Which assessment data should be reported to the healthcare provider? So the reason in the Blue Book Mark calls this the discomforts and dangers of pregnancy is because discomforts are expected, dangers are unexpected. So let's see which of these are discomforts and which of these are dangers. The client has nasal stuffiness and epistasis. Epistasis or staxis, I don't know how to say it, is nosebleeds. Y'all, that is a discomfort of pregnancy. It's not a danger, it's a discomfort. So that's expected. The client reports severe dizziness and blurred vision. That doesn't sound good. So B does not sound good. That's not an expected discomfort. C, the client experiences breast tenderness and enlargement. That's a discomfort of pregnancy. The client mentions increased leukorrhea. If you don't, I use the word leukorrhea on purpose. They actually have increased white vaginal drainage. That's leukorrhea, white vaginal drainage. It actually is a discomfort of pregnancy. It's increased in the first trimester. And so that's expected. So what did I say was not expected? Well, dizziness and blurred vision is certainly not expected. So that's a danger. A, C, and D are all discomforts of pregnancy, and it is uncomfortable at times, a lot of times. So discomforts are expected, dangers are not expected. During a prenatal visit at 10 weeks gestation, which is the first trimester, a client tells the nurse she's gained 6 pounds since becoming pregnant. Which action should the nurse take first? So that's kind of the high end of normal. So I'm like, well, she's really supposed to have gained 3 to 6 pounds by week 12 or 13. So she's get close to the high end. So let's see what our answers are. Praise the client for appropriate weight gain. Maybe, if nothing else makes sense, maybe, but she seems a little high. Assess the client's dietary habits and activity level. That seems like a good idea. I don't want to necessarily tell her she's gained too much, but I'd kind of like to know how she's eating and if she's staying active. Recommend the client reduce caloric intake to prevent excessive weight gain. I don't want to do that until I know how she's eating. Document the finding as normal. Continue. I'm not ready to document it as normal until I assess her dietary habits and activity level. So I'm not sure if it's unexpected or not. It's the high end of normal, so I'm going to see how she's doing before I call it a concern. A woman in her first trimester of pregnancy discusses her symptoms with the nurse. Which symptom requires immediate intervention? That means which is unexpected. Okay. The client complains of fatigue and needs frequent rest periods. Y'all, fatigue is a discomfort of pregnancy, particularly in the first trimester. The client experiences mild gum bleeding while brushing their teeth. That's actually a discomfort of pregnancy, y'all. That is a discomfort of pregnancy. The client reports severe vomiting several times a day. That's a problem. A red flag word is severe. There's certain red flag words that I don't like on the NCLEX. Severe is one of them. Always, never. These are like extreme words. Those are always red flag words for me. So C is a red flag. The client mentions occasional headaches relieved by rest. That's a discomfort of pregnancy because of hormonal fluctuations. So yeah, I'm concerned about the severe vomiting. That's the one that requires immediate intervention. A nurse is educating a group of women in their first trimester about scheduling prenatal visits. Which statement indicates a need for further teaching? Further teaching. I'm looking for the false statement. Further teaching, false statement. I need to schedule prenatal visits every month until I'm 28 weeks along. Regular prenatal visits help ensure my baby and I remain healthy. I should start regular appointments when I'm 10 weeks pregnant. After 28 weeks, I need to see my healthcare provider more frequently. So the rule is once a month until week 28. And in maternity language, a month is always 4 weeks. Okay. So I know in real life, a month is sometimes 5 weeks, but in maternity language, a month is every 4 weeks. So they're supposed to see their healthcare provider every 4 weeks until week 28. So 4, 8, 12, 16, 20, 24, 28. So they should see by the time they're at week 28, they should have seen them 7 times. And then they go every 2 weeks until they're full term. So every 2 weeks until they're week 36, and then once a week until delivery. So D is a true statement. After 28 weeks, I'll need to see my healthcare provider more frequently. Regular prenatal visits. B, help ensure my baby and I remain healthy. That's true. That's why we do them. And A, I need to schedule prenatal visits every month. That's true until week 28. So we don't start at week 10. We start at week 4, seeing the healthcare provider 4, 8, 12, 16, 20, 24, 28. That's the schedule. A client at 8 weeks gestation attends her prenatal appointment. Which assessment finding is most concerning? So I'm looking for the unexpected finding. The client has a low-grade fever and reports burning on urination. Y'all, that's classic UTI. So a UTI is considered a danger in pregnancy because that infection can move up and cause infection in the placenta. So that's a problem. The client has gained 2 pounds since her last visit. So 8 weeks. So her last visit should have been 4 weeks. Remember, because it's 4, 8, 12, 16. And they're supposed to gain about a pound a month. So she's gained 2 pounds. So she's gained a little more than she should have. But remember, it can be a little flexible with that, like a pound or so off, right here or there. So I'm okay with 2 pounds. The client reports feeling ambivalent about the pregnancy. So the first trimester, very commonly, this is how they feel. They're just trying to grasp the fact that they're pregnant, especially if it's their first pregnancy. Like, it just is hard to believe because they don't really feel that much different. I mean, they feel more tired. They may have some bleeding gums. They may have some increased leukorrhea. They may have nausea, but they don't really feel pregnant, right? And so they often feel very ambivalent. So the kind of the developmental goal during the first trimester is just to accept the fact that you're pregnant. So that's kind of expected. The client experiencing mild low back discomfort after standing. Well, usually low back pain doesn't start until the second trimester, but after standing, yeah, sure. Don't we all have low back discomfort after standing for very long? Maybe not all of us, okay? But at my age, we do. So yeah, I'm more worried about the UTI, definitely. I mean, if I had to pick between A and D, I would definitely go with A. That's unexpected. A client who is 8 weeks pregnant attends her first prenatal appointment. She asks the nurse how much weight she should gain during her pregnancy, which response by the nurse is most appropriate. You should gain about 25 to 35 pounds evenly throughout your pregnancy. All right, I like that answer because it's 25 to 35 pounds, which is usually about where we say. So Climic teaches 28 pounds plus or minus 3, but 25 to 35 is right in there. So that's about right. The problem I have is it says evenly throughout your pregnancy because it's not evenly. You gain a lot more weight in the second and third trimester than in the first. So I'm going to put a question mark next to that. Weight gain isn't important in the first trimester. Focus on gaining. No, that's not true. Weight gain is important in the first trimester. You gain a lot more in the second and third, but that doesn't mean we ignore it in the first. Your recommended weight gain depends on your pre-pregnancy body mass index. Let's calculate it together. So the reason I like A is because 25 to 35 pounds is the recommended weight gain for women with a BMI between 18 and 25. And we kind of memorize that number because we just assume women have a BMI of within normal limits, which is 18 to 25. But I do know if women are underweight, when they get pregnant, they need to gain a little more weight than that. And I know if women are overweight, they need to gain a little less weight than that. So that C makes sense to me. That statement makes sense to me. Try to limit your weight gain to no more than 15 pounds to reduce the risk of complications. That's not true. We want women to gain enough weight that they have a healthy baby. So the reason I don't like A is because it says evenly throughout your pregnancy. I like C because that is a generally true statement. Okay, well, that is all. A short and sweet video for you. I hope you found that helpful. It's actually some really important information. I know it went fast, but if you're like, yeah, that's interesting, Sharon, but I don't really know it, then watch the video again. You need to know this information. It's important for you to know. And I wish you all the best on your NCLEX and any other standardized tests you might be taking. Thanks for being a part of our family.